If you have pain on one side of your lower back and you are not sure if the pain is coming because of sciatica, which is because of the disc herniation in your lumbar spine, or is it because of something else in your lower back, which can possibly because of SI joint. So in this video, I will tell you an easy way by which you can assess yourself, and by that you will get to know that the pain which you are having in your lower back on the one side, is it that because of sciatica or is it because of SI joint. I will also talk about the differentiation of the symptoms between these two. And if your pain after the assessment is because of SI joint, then I will give you some best exercises which you can do by yourself at your home, and by that you can decrease the pain of your SI joint. By the end, I will also talk about some tips and tricks by which you can make sure that the pain of the SI joint or the pain on one side of your lower back doesn't come back again. So watch this video till end. Let's get started. So guys, let's just talk about the symptoms by which you can differentiate if the pain in your lower back or one side of your lower back, is it coming from sciatica or is it coming from SI joint. So symptom number one, if you have sharp shooting pain on one side of your lower back, which is traveling down to your buttock, to your thigh, and to your lower leg below the knee level, then it is most likely because of disc herniation in your lumbar spine and sciatica. But if the pain on one side of your lower back feels like an ache and it does not travel below your knee level, but it sometimes travels to your hip joint and into the groin and mostly stays on the dimple area on the lower back, then most likely it is because of SI joint pain, not because of sciatica. So, symptom number two, if you have numbness, tingling, or weakness in your one leg, then it is most likely because of the disc herniation or sciatica, along with the pain as well. But in SI joint pain, the true weakness and numbness is generally absent. So, let's talk about symptom number three. If your pain increases with sneezing, coughing, bending forward, or sitting for a long time, then most likely it is because of sciatica. But if your pain increases with prolonged standing, walking, stair climbing, turning in the bed, or standing on one leg, then it is because of SI joint pain. So, guys, let's just do two simple tests by which you can easily assess your pain and get to know if it is sciatica or the SI joint pain. So, let's do the test number one. All right, friends, let's do the first test. So, to do the test, all you have to do, you have to sit down on a chair. And when you sit down on a chair, you have to slouch forward, and then you have to bend your neck downwards to the front, and then you will straighten the painful leg, and you keep the knee extended just like this, and then you bring the toes towards your face just like that. And after doing that, if the pain starts to traveling down to the leg with the numbness and tingling, then this test is positive for sciatica. So this means that the pain you are experiencing on one leg is because of sciatica or disc herniation, but not for the SI joint. So friends, let's do the second test. To perform this test, you have to stand straight and you have to stand on one leg, which is the painful one. So you stand on one leg just like that. So you are standing on the painful side. So you stand like this for 20 seconds. And if by standing on the one leg, which is the painful already, so if the pain is increasing more by doing this, so that indicates that the pain which you're experiencing now is because of SI joint pain, but not because of the disc herniation or sciatica. To perform the first exercise, you have to come onto your hands and knees, and then you push back the buttock on your heels, just like this. And then you come back to the original position, and you keep doing this back and forth. And you repeat this 10 reps in one set, and you do 3 sets in one day, 3 times a day. To perform the second exercise, you have to lay down on your back. You bend your one knee and put the other leg on the bent knee. Now you have to roll to the bent knee side. By doing this, you will feel the stretch on the other leg. And you repeat this for at least 10 times in one set. And you can do this for at least 2 times a day, like 2 sets, and each set consists of 10 repetitions in one day. To perform the third exercise, you sit next to a couch and you put one leg on the couch or on the chair. And you make sure that the leg which is on the couch, it should be in the 90-degree angle at the knee. Now you start moving away from the leg which is on the couch, and you keep moving until you feel that nice and easy stretch at the buttock, at the SI joint. You hold it there for 5 seconds, and then you can start moving back. So you can do this for at least 10 times in one set and 2 sets in one day. So friends, let's talk about the tips and tricks which you should follow to avoid the SI joint pain. Tip number one, avoid twisting on a planted foot. Pivot your feet so that your whole body turns together. Tip number two, avoid sitting or standing in one position for more than 30 to 45 minutes. Tip number three, avoid standing on one leg or carrying loads on one side. Fourth and the last one, keep your core and your buttock muscles strengthened to improve the pelvic stability. So friends, in today's video, I have demonstrated the exercises which can be done in case of SI joint pain. But if your problem is not SI joint, but sciatica, and you want me to make a separate video on disc herniations or sciatica, please comment down below and share this video with someone who has SI joint problem. And don't forget to like, share and subscribe.